Hello everyone. You know what time it is. It's time for your top 5 to stay alive for May 2018. Let's get right into it. You know, when it comes to Parkinson's disease, there's currently isn't a cure or even a definitive test your doctor can use to diagnose it. Typically, it's enough to confirm a diagnosis if a patient has at least 3 or 4 major symptoms, and in the US alone, doctors make that determination over 60,000 times per year. But untold numbers of those patients don't need the drugs, treatments, and everything else that comes along with a doctor's confirmation of this terrible disease. Classic symptoms of Parkinson's, like loss of balance, shuffling gait, and tremors, can be caused by something other than the disease, which means that they don't really have Parkinson's to begin with. It even has a name called drug-induced Parkinson's, or DIP. And that's something that you're going to want to share with everyone you know. As you may know, Parkinson's disease is basically the slow destruction of cells in the brain that produce the all-important chemical messenger called dopamine, which is vital in maintaining your mood, your movements, and everything in between. Some drugs can block dopamine in your brain, which can trigger almost exactly the same symptoms as full-blown Parkinson's. But here's where things can get really confusing fast. The meds prescribed to control Parkinson's can be devastating all on their own. One called Xadago, which was approved by the FDA just a little over a year ago, lists side effects such as uncontrolled involuntary movement, and falls are said to be the common adverse reaction. So someone who is suffering from DIP may be very likely to be put on another drug, one that can also produce terrible Parkinson-like side effect. It's the very definition of a vicious cycle, but it may never be recognized. And according to Public Citizens Health Research Group, 49 drugs have been identified as potentially triggering this reaction. 2 of the drugs that can cause DIP, Compazine and Reglan, are prescribed to treat heartburn and nausea. Others include antidepressants and antipsychotics like Zoloft, Haldol, Risperdal, and Nardil. Meds given to prevent migraines such as valproate, and those intended to prevent seizures like Gabatril. Of course, any and all meds prescribed off labels, so an unsuspecting patient can get an anti-seizure drug or antidepressant for just about anything, major or minor. I know that all sounds crazy, but it happens all the time. The good news is that if someone does have DIP, getting off the drug that triggered it usually reverses the condition, in effect curing their Parkinson's. Just know that it may not happen immediately. It can take several months for the symptoms to be reversed. So if you or someone you love has been diagnosed with Parkinson's, or even if you're concerned enough to be Googling symptoms of the disease, the very first thing to do is check out your medicine cabinet. And if you're not sure, do some research immediately. The stakes are too high to put off. Shall we move on to topic number 2? Do you suffer from arthralgia? It sounds scary, and if you do suffer from it, it can be tough for you to get through the day. When it's really acting up, even the simplest tasks can seem too impossible. I'm talking about arthritis, and being that over 50 million Americans are dealing with the pain and stiffness of it, there's a very good chance that you have it too. Obviously, if you experience joint pain, drugs are a big part of your life, as treatments typically consist of a lot of over-the-counter pain relievers, sometimes taken every single day. Those versed in pharma speak, however, know that drugs play a bigger role in arthritis than you might ever imagine, because hidden in plain view are some warnings that would have you thinking twice about popping some of the most common meds out there, if you know how to decode them. Of course, while joint pain can come from causes ranging from Lyme disease to illness and injury, it's most often considered to be one of the typical side effects of aging. Just one of those things you have to put up with, right? No, not necessarily. Of course, it's quite well established that statins can cause severe muscle pain, weakness, and as I've been telling you for years, but joint pain too? Yes, It's true, and now it's a new discovery. Even, in fact, 6 years ago, Dutch researchers found that drugs were linked to an increased risk of developing rheumatoid arthritis. And just this past February, some of those same scientists published another study on the topic. This one says that their findings show that the risk of developing rheumatoid arthritis is substantially increased during the first year that a patient is on a statin. But like the way big food tries to conceal the presence of MSG and high fructose corn syrup and products in the supermarket, Big Pharma has its own method of keeping you in the dark. Because if you read the lengthy label for Lipitor, one of the best-selling statins, you'll find arthralgia, aka joint pain, hidden among the most commonly reported adverse reactions, along with another tongue twister, nasopharyngitis, also known as a head cold. I guess that drug makers don't want us to know the whole story, right? But unfortunately, statins aren't the only drugs that can cripple you with pain in the joints. 3 years ago, the FDA sent out a warning on some of the most popular diabetes meds out there, including Januvia, Onglyza, and Tradjenta, saying that they can cause joint pain that can be severe and disabling. Those drugs, known as DPP-4 inhibitors, can start triggering pain from day one or even years after starting up on them. And after patients stopped taking them, all it took was a month or less for the arthritis symptoms to disappear. How's that for proof positive? Acid suppressors, known as proton pump inhibitors, and an entire class of antibiotics called fluoroquinolones, more commonly known under the brand name Cipro and Levaquin, can also cause the same kind of pain. So before you write your arthritis pain off as simply one of those melodies of getting older, do some sleuthing first. Starting right in your own medicine cabinet. Talk with your doctor about getting off any unnecessary drugs, which include a lot more than you can imagine, as soon as possible. Topic number 3. Two of the most feared superbugs, CRE and CRPA, have now been identified all over the U.S. And the CDC scientist Ann Schuchat put it, "We found nightmare bacteria in your backyard." The results of a nationwide hunt, the CDC's discovery, tells us that these superbugs, which are impossible or nearly impossible to kill without current arsenal of antibiotics, have made more inroads than experts realize. Should they cross your path, they can turn a seemingly minor infection or a medical procedure into a death sentence. And if we don't do everything in our power to stop what's happening, it may soon be too late. That's why there's no time to waste in taking some simple but vital steps toward keeping yourself and your loved ones as safe as possible from these deadly invaders. The recent discovery of over 221 germs with unusual resistance to antibiotics was a shock to many experts because, as Dr. Schuchat describes it, these are pathogens have been hiding in plain sight. As for the nightmare bacteria that kills over 50% of those who become infected, the agency identified it. Guess where? In hospitals across 27 states. But how that bacteria advances its troops is even more frightening. A CDC spokesman refers to it as the triple threat, explaining that not only can the pathogen spread and infect others, but the genes that allow it to be resistant can also be shared by other bacteria. Experts have been in a panic about this impending crisis for years. As a professor of infectious diseases observed some time ago, we're already falling off the cliff. But not to worry. The feds have finally crawled into action. Oh, they're good at that. 2 years ago, the CDC started its antibiotic resistance lab network called the SWAT team approach, setting up research labs in all 50 states that share information and have the ability to detect these superbugs, even in food, as well as diagnosing people that carry the germs. And yes, we certainly need that kind of approach. However, we won't be able to put a lid on this menace until we halt two of the main behaviors that got us into the mess in the first place. Number one, the practice of giving perfectly healthy farm animals antibiotics every single day is still a commonplace in farming. Regardless Of all that we know and fear about superbugs, up to 80% of antibiotics sold in the U.S. continue to go straight to the farm, not to the pharmacy. Number two, doctors still routinely give out antibiotic prescriptions to people with viral conditions, even though these drugs are totally ineffective against them. And despite the efforts of the CDC special laboratories, superbugs are still killing around 23,000 Americans annually. Last year, I told you about a woman in Nevada hospital who was infected with CRE, one of the germs in the CDC was looking for. Doctors tried to save her life with over 24 kinds of antibiotics, but nothing worked. Those casualties, however, will be chicken feed compared to what's being predicted. Experts say that in the next few decades, the superbug plague will kill 10 million people nationwide. That's why you need to do everything possible to reduce your exposure to these deadly pathogens. First of all, the hospital is obviously one of the places where you're most likely to encounter it, so if you or a loved one is hospitalized, be sure that any IVs or catheters are removed as soon as possible. Next, stop taking antibiotics just because your doctor said, let's do this to be on the safe side. Anytime your doctor gives you a prescription for one and you don't have bacterial infection, ask why you need it, and if your general practitioner is a habitual antibiotic prescriber, maybe it's time to shop around for a doctor who understands the seriousness of this threat. Start buying organic meat and poultry. Organically raised farm animals aren't given routine antibiotics unless they're sick, at which time they're no longer considered to be organic. And every single expert is telling us what mom was telling you a long time ago. Washing your hands often and thoroughly will go a long way toward keeping those bugs out of circulation. Topic number 4. If you were charged with a DUI, your license to drive would be suspended in the state where it was issued. And thanks to a coordinated effort in the U.S. that exchanges information between state DMVs called the Driver License Compact, you won't be getting a license in any other locale while that suspension is still in force. But a license to practice medicine, even surgery? Well, that's another story. A new investigation has revealed that doctors can bounce from state to state, set up shop in new locations, even while banned from practicing in others. It's a national scandal, one that should have been fixed long ago. And the bottom line is, if you aren't familiar with the history of the physician who's treating you, it may be time to do some digging into their past. Here's what you need to know. Little Morgan Brooks was 2 months old when she was given a laxative at twice the dose an adult should be taking. Tragic mistake? Well, the Illinois Board of Professional Regulators didn't think so because it turns out that Dr. Jay Reisman had ordered the exact same overdose on another baby just a week prior. Due to that incident and others, Illinois suspended his license for a minimum of 5 years. But instead of hanging up his hat, he simply moseyed across state lines to hang up a new shingle in Missouri, and today he practices at St. Luke's Hospital in Kansas City with a license that's valid in that state. But Reisman is far from the only doctor who's pulled that trick. A joint investigation by the Milwaukee Journal Sentinel and MedPage Today discovered that he's one of over 500 physicians facing serious disciplinary action, including some who've been stripped of the right to practice medicine, who have slipped through the system and gone on to practice elsewhere. Experts say, however, that 500 isn't even close to the real number. That's despite the fact that the federal government maintains a database that was created to keep track of malpractice payments, state disciplinary actions, and other restrictions so as not to let disciplined doctors jump from state to state without officials knowing their history. But guess what? The information contained in over 1.3 million records on the file with the National Practitioner Data Bank isn't available to the general public. That treasure trove of data on doctors is released only to hospitals, insurers, and state medical boards. So why aren't states making use of this information? It turns out that most just don't bother. If individual states aren't looking out for your welfare when it comes to practitioners that they're granting licenses to, how can you protect yourself and your family from one of these devious doctors? Well, you shouldn't go by how a particular hospital ranks one of its physicians, as that very well may not tell the whole story. Reisman, for example, is unbelievably characterized by the Kansas City hospital where he currently works as having served his patients, their families, and his staff with clinical excellence and patience and insight. Yeah, but there is some good news because it is possible to get some information on your own. It will, however, take a little bit of sleuthing. One way is to go to docinfo.org. That's docinfo.org, a search tool run by the Federation of State Medical Boards. Enter a doctor's name, and you'll find out which states they are licensed in and if there have been any actions taken against them. To get further details, though, you'll have to directly contact that state's medical board. That way, you can be sure that your doctor hasn't been given a license to practice bad medicine. And finally, topic number 5. It seems that whenever a study is published showing how certain drug can cause you harm, you'll immediately hear from doctors rushing to exonerate the med in question. Something else must be going on here, is their typical response. And of course they'll say those people were sick to begin with, or they wouldn't have been taking blah 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 anyway. Talk about a knee-jerk reaction. Now we're hearing from researchers out of Tulane University in New Orleans about how antibiotics, once again talking about antibiotics, the drugs that can protect you from killer pathogens, can also damage your heart and raise your risk of dying from cardiovascular disease. Mainstream critics wasted no time in countering with comments that anyone who needs to be on these drugs for prolonged periods must be inherently sicker and more fragile, and how such results are not surprising when taking that into consideration. But then, some doctors will bend over backwards to justify giving out their favorite meds like they're candy. Of course, when you really need an antibiotic, you really have no choice. However, the conclusions of this study should give you good reason to pause and ask your doctor 2 very important questions before unthinkingly filling that prescription. Taking drugs is almost as risky proposition, some more than others, and often certain meds will keep boomeranging back to us with newfound side effects. Antibiotics, for example, are already known to commonly cause diarrhea, vomiting, stomach pain, rashes, and the whole host of other adverse reactions. Now you can add heart disease to that list. In this latest study, a big one that looked at 37,000 healthy women in the U.S. and followed them for 8 years, Tulane researchers concluded that women over the age 59 who reported long-term use of antibiotics were almost 60% more likely to die from heart disease. That's particularly alarming because what those scientists considered to be long-term was just 2 months. And there are plenty of reasons why someone would be on an antibiotic for 2 months or more. Lyme disease, asthma, recurring urinary tract infections, to name a few. What's more, that risk could be present itself in years later and not just in the form of heart disease. Researchers also found that women who used antibiotics over a prolonged period of time, 10 years prior, also upped their risk of death from all causes. But how could antibiotics turn out to be killers when they're also lifesavers? As we've known for a while, antibiotics can devastate the beneficial bacteria in your gut. And when this essential part of your immune system gets thrown off balance, you can be vulnerable to practically any ailment or disease, whether you've been taking them for 2 weeks or 2 months. As Dr. Stanley Hazan from the Cleveland Clinic put it, there's a magnitude of importance of gut microbiome is far greater than we've anticipated. Even the Tulane group made sure to comment on how alterations to your gut bacteria are linked to a variety of life-threatening disorders that includes heart disease. The real problem here is that antibiotics are widely overprescribed for conditions that they typically can't even help, all just to be on the safe side. But as we're hearing again and again and again, there's nothing safe about taking these drugs for any amount of time when they're not needed. So when it comes to these life-saving meds, remember to save them for when they're absolutely necessary rather than popping them haphazardly for every little thing. And a good way to be sure you're going to make sure this happens is to ask your doctor 2 questions before rushing out to get your prescription filled. Number 1, do I really need this antibiotic? Illnesses such as cold, bronchitis, sinus infections, sore throats are conditions that are most often caused by viruses which antibiotics have no effect on. If you've been diagnosed with something other than a bacterial infection and you're given a prescription for one anyway, ask why. It will give your doctor a pause to reconsider. Number 2, does this drug specifically target my infection? If you really do need an antibiotic, ask your doctor for one specific for that kind of infection you're suffering from, which could require that a culture be taken instead of simply turning to big guns such as Cipro. One expert called the overuse of broad-spectrum antibiotics is a habit of lazy doctors. And if you're on or have been on a course of antibiotics, make sure that you're also taking a high-quality probiotic supplement, something that will significantly benefit your health regardless how recent or long ago that may have been. Also, eating plenty of foods known as prebiotics, which are in Cleanse and Cardio for Life, will help feed the beneficial bacteria in your gut, keeping them happy and able to do their job. Some good prebiotics include apples, oats, bananas, asparagus, and surprisingly, cocoa. But before you go out and begin eating the second ear off the chocolate Easter bunny that was supposed to have been for you, the kids, remember that it's dark chocolate or even plain unsweetened cocoa powder that can provide those benefits. Moving on to testimonies. We've got quite a few here today. It has been 6 years since Sandra and I started using Cardio for Life. Sandra will be 76 in June and I will be 80 in July. We are both reasonably fit and active for our ages. I personally have a great feeling of well-being thanks to God, Sandra, you, and Cardio for Life, and of course our family and great friends. Life is great and the best is yet to come. What an outlook on life, positive outlook on life. Thank you, Bob from Australia. Dr. Harry, just wanted to let you know my husband stopped taking his cholesterol meds the day I received your Cardio for Life product. His doctor did a cholesterol test on him and he was impressed because his bad cholesterol was 80. He told my husband to continue taking his cholesterol meds, and that's when my husband told him he had stopped taking it months ago. His doctor then said, well, you're eating a better diet. My husband said, no, I can't afford that. That's when he told the doctor, I'm using Cardio for Life, a product my wife searched out on the internet and got for me. I feel so much better too. And by the way, I stopped taking that blood thinner medication too, and I'm no longer having chest pains. His doctor was actually speechless, and the only thing he could say was, well, keep up doing what you're doing because it appears to be working. Thank you for making this Cardio for Life product. Thank you, Stiana, for that. And here's one. It's been 2 weeks now since I've been using Cardio for Life 3 times a day, and someone just told me I look back to my old self. In fact, I do have more energy. The cardiologist also told me I'm out of the danger zone. My valve is 40% open. I'm on my way in 2 weeks to see my cardiologist in Florida, who did not give me a statin drug I'm excited about, and I'm canceling my hospital appointment in Canada. I'm tired of going from drug to drug, 8 drugs altogether. I take Cardio for Life, exercise by walking 20 minutes per day, and watch my diet. No fried foods or fast foods. I look forward to being healthy again. Thank you again for Cardio for Life. Thanks for that, John. Dr. Harry is always there whenever you have a question or concern. His products are first rate, and I recommend them to anyone who likes to be on top of their health. I've been using the Cardio for Life and Cleanse products for several years, which have been so helpful. If you're concerned about maintaining a healthy life, check out the Health Guardian. Thanks, Charlie. Thank you for that call Sunday night. It was very calming. I was touched by your kindness and just wanted to thank you again. You made me feel so much better, and no one could put a price on that. Well, thank you for that, Dr. Ruth Anna. So it's not always about the product. Sometimes it's just about talking and listening to people and giving them different courses of action, giving them options, which is so important. Well, that concludes our top 5. I hope you enjoyed them. Share them with your family and friends. And remember, we are here to optimize your health. We are defenders of holistic health, and here to do that through products like Cardio for Life, Cleanse, Flex, Slim, Trim, Man Up, so many, and Thermomax. For now, this is Dr. Harry saying God bless you all. Good day.